Dr. Alex Garza with the Pandemic Task Force is joining us live.
All right, let's get right to it. Busy weekend ahead for people on Labor Day. So if you're having an outdoor socially distanced event, Dr. Garza, what's your advice for the safety of you and your guests?
Yeah, so a little bit of a complicated question. And the reason why I say that is because everybody's sort of risk is a little bit different. So certainly I would not advocate for large gatherings, first off. Secondly, it depends upon who's at your house. So if it's elderly, which we know are high risk, people that have health conditions that are at high risk, then you should be a little bit more protective of those individuals. But certainly all of the things that we've talked about, previously, social distancing, I know it'd be tough to wear masks at social gatherings, things like that, hand hygiene, all of those things that decrease risk of transmission are really important to pay attention to. But as I said, each situation is a little bit unique, but if you can practice some of those things that decrease that risk of transmission, you're going to be much better off. And I would say by far and away, no large gatherings. That is just a complete no-no.
A follow-up to that, when many people have concerns with the college students coming home this weekend, and we've seen that big increase. What, 7,000 college-age people testing positive since school began? What are your thoughts with the students coming home? How do you handle that as a parent?
Yeah, and again, it sort of goes back to what I was talking about before. So, so part of it is, what is the risk of a student bringing something home? So if they're on a campus where there's a large outbreak, they believe they've been exposed or they know they've been exposed, then that's one scenario. If it's a college where there hasn't been an outbreak, it seems like their mitigation efforts are working well. And then who are they coming home to? So again, not every parent is, healthy and young. People have health conditions that could be on chemotherapy, could have grandparents living in the household. So you have to take all of that into consideration. So certainly the easy answer is, isolate yourself and wear a mask all the time, but it's really dependent upon the situation. So I would just say, take into account all of those things and then act appropriately, whether that is keeping socially distant, wearing a mask, even if you've got people that are immunocompromised at home or elderly. That may be the safe thing to do.
Let's follow up on the students for a minute. The younger people really aren't showing symptoms all that much, and some infectious disease experts even suggested letting the virus kind of circulate through the population. That way it's somewhat controlled to get more people with immunity. Do you think that's kind of what we're seeing with some of these college students and some of those school-age kids? Because it seems to be going pretty well. We're not seeing it get too bad for those students right now.
Yeah, so certainly younger people do better with COVID than elderly or people with chronic health conditions. So that is true. So the challenge that we have, though, is if you sort of let, if you try and accomplish herd immunity by letting the virus just run through the population, it exacts a toll on those more vulnerable populations. And that is accounted for in increased deaths or increased admissions to the hospital. So while it's true that some of this is building immunity in the population, if it's unfettered spread throughout the community, it will affect those people that are not so fortunate to have, either perfect health or to be younger than the population that it is affecting right now with those college students.
All right, back to Labor Day here. What happens if I think I may have been exposed? If you go to get tested too early, will it not show up? If I wait too long, is it too late to get some of the drugs? What's the sweet spot here to get tested?
Yeah, good question. So when you think about how you get tested for COVID, it is looking for really for it's RNA, but the DNA of the virus. And so, but it has to have a certain amount of virus in order to find it. And so that's called the threshold. And so in order to do that, as you can imagine, the more the virus replicates, the sicker that you get. And so if you test too early, the virus hasn't replicated enough, so you're not going to find it. So typically what we advise is anywhere from like a 5 to about 7 day range after exposure should be pretty close to when you should be able to find that virus. Now, everybody's different though, and there's cases where it's gone out to 14 days. And so even that is not an exact science, but but by and large, that is around the time range that we're looking at.
All right, there's so much talk about masks these days, and I think we all get it at this point, right? We know the rules. What have you personally learned maybe over the past few weeks or maybe the month that maybe you didn't know previously that you can pass along to us in regards to mask advice? Is there anything new?
There's not a whole lot new out there as far as masks are concerned, nothing that we haven't discussed already. Some of the things that I've learned is that I've become more comfortable wearing a mask where, if I'm in the office, sometimes I forget that I have it on. And so that's one thing I've personally learned. Now, as far as the science is concerned, there is some interesting science coming out about people that wear masks that are exposed to maybe people that aren't wearing masks. So certainly a mask doesn't protect you like a medical grade mask from exposure to the virus. But researchers are now finding that people that wear a mask, if they are exposed, have a lower dose and then can have a more mild illness and develop immunity to it, because if it makes sense, there's less virus getting through, you have a lower dose, you can still develop an immune response. And so that's good for the person that's wearing the mask.
And very quickly, today you announced you're taking part in that SLU COVID vaccine trial. That's pretty exciting to think that this is happening here. Tell us about that.
Yeah, we're very fortunate to have some remarkable academic institutions here in St. Louis, and certainly St. Louis University's Vaccine Research Center is one of those. They've worked on a multitude of vaccines over the years, and so they are taking part in the vaccine trials with the Moderna vaccine. And so I went to their website, filled out my information. I was randomly chosen to participate in the trial. And so today was the day when I go down and go through all the paperwork, get my blood drawn, receive a shot. I don't know if it's vaccine or if it's placebo. And then I'll be followed over 2 years to see what effect the vaccine has.
Wow. Very exciting. We'll see how it goes.
Yeah.
A lot of good developments. So let's hope we get some good news very, very soon. Dr. Alex Garza, great for making time for us on this Friday, and we'll talk to you soon.
Okay. Have a good weekend.
All right. Sandy.